But that's an easy mistake.
Oh, absolutely.
Very.
And it's common.
I would say that was the next word going to come out of my mouth. It's also very, very common because it can get complicated very quickly.
Sure.
I'm Susan Goss, and as a seasoned therapist of more than 15 years, I'm honored to have had the opportunity to gain so much wisdom from so many people and love passing that knowledge on to others. So join me and some of my favorite friends as we share some tangible truths with you.
Hey guys, welcome back to the Tangible Truth Podcast. I'm Susan Goss, and with me today is Dr. Billy Jones. Hey, Billy.
Hello, Susan. How are you?
Just fine. I am so excited, listeners, to have Dr. Billy Jones. Number one, Billy is a friend of mine. But number two, in case you are not aware, listeners, the month of May is Mental Health Awareness Month. And listen, that is an important month, especially in our field. You're going to hear more about Billy. I'm going to introduce him in just a minute. But Mental Health Awareness Month began in 1949. Billy, that was 76 years ago.
It is
I can't believe it. That's crazy. And was started by Mental Health America. So we are going to talk a bit about mental health, and Billy is so qualified. I picked him on purpose to be my guest for Mental Health Awareness Month. And Billy started off, we were talking before the podcast, and I found that so sweet how your career started. You started off as a teacher. As your undergrad, you didn't know you were going to teach.
That's right. I was a mental health professional at a psychiatric hospital for a while. And I guess a nurse's assistant would be the way to word it, a mental health technician. And at the time, I was living in Georgia, and they had a desperate need for special education teachers. And so if you had a degree in psychology, you could be hired as a special education teacher as long as you went and got your master's degree in education. And so that's what I decided to do.
Okay. And then what was your next step?
Well, so teaching, I decided I need to do something a little bit different than teaching, as it is incredibly difficult.
Yes.
It is,
Yay,
as you
teachers.
well know.
Yay, teachers.
Yay, teachers.
I was
indeed.
also a teacher, you know.
I do know that. And my wife is a teacher. And so teaching is very difficult. And so I decided I wanted to merge the psychology degree with the education degree. And so I ended up getting my doctorate from the University of Georgia in educational psychology. And I have committed myself to being a psychologist and kind of specializing in psychological evaluations.
Excellent. So that's where your PhD came into play.
Yes.
And educational psychology. And so now you're currently a psychologist, and that is your profession.
Yes.
Currently.
Yes.
So that is who we have on our podcast now. He is very much our professional. And so that is why I have invited Billy on Mental Health Awareness Month. And we're going to just start right off the gate in this question, Billy. It's a question that everybody seems to have all the time. Who, what, where, and why? Okay. Who do I go to? What is that title? What does it mean? And why would I go to them? All excellent questions.
Very good questions.
Very good questions. And so that is what I want to cover. I will give you an example. I'll use myself as an example. I am an LPC and an LMFT. So somebody might ask me, Susan, what does that mean? And why would I go to you? I am a dual licensed therapist. So I am a licensed professional counselor, and I am also a licensed marriage and family therapist. So I would see individuals and I see couples. If you love seeing couples, that is what you will see most of, because not as many therapists see couples as they do individuals, right?
Right.
And I do love it. It doesn't mean it's not hard, but I love it.
It's very fulfilling, I would think.
It is, if you're called to do that.
Absolutely.
And I feel I am, and I love it. Also see families with that dual degree. Now, LPCs do too, but there's just a little bit extra training there with that dual degree. So that would be an example of those initials some people look at and go, what is that?
Exactly.
And why, why would I see them? And that kind of thing. So I would like for you to give some of those examples. I know that everyone knows this. MD is
medical doctor.
Medical doctor.
And so an MD.
And these are rhetorical for me. I already know, but you're the professional, and I want you to explain it.
Yeah. So an MD is a medical doctor, and so they can prescribe medications, and they can prescribe mental health medications as well as just regular medications for strep throat or any type of illness that you may have. Obviously, you have different specialties within the MD field. And so you could have family physicians, you could have pediatricians, endocrinologists, et cetera.
And they're great at diagnoses.
You're talking medical diagnoses?
Yeah, medical diagnoses.
Yes. And then if you want to, and some are very good at mental health diagnoses as well.
Yes, they are.
But oftentimes they'll refer you to a psychiatrist who is also a medical doctor. And they're the ones who
Can I stop you for a second?
Oh, please. Yeah.
Psychiatrist. I want to emphasize that some people don't know that psychiatrists are also medical doctors.
Yes. They have an MD and specialize in the treatment of medications and mental health. So they will meet with you, do a clinical interview, and if medication is needed, then they can go ahead and prescribe medication and try to get you moving in the right direction. But typically, psychiatrists do not do testing or evaluations. That would be more of a PhD, which stands for Doctorate of Philosophy. And so a person with a PhD could specialize. They could have an English PhD and or a math PhD. And a lot of times those are professors at universities. But if you have a PhD in psychology and you go through the licensing board and get everything done, then you can become a psychologist. And so as a psychologist, you're eligible to do psychological testing and evaluations. You could do counseling if you choose to do that, but you are not eligible to prescribe medications, at least in Arkansas. There are a few states where if you have additional coursework in medicines, psychopharmacology, you're able to prescribe medications, but Arkansas is not one of those states.
Okay. So in your case, you are a psychologist.
Yes.
So you are a PhD psychologist. So you provide assessment and testing, but you do not provide counseling. You have chosen to choose one.
That's right. When I first graduated from the University of Georgia, when I first got my degree, I did both for a little bit of time, let's say a year. And I decided, I really can't specialize in both testing and counseling. I don't feel as though I personally am qualified enough to go down both roads successfully. And I had to choose because my doctorate is in educational psychology. That tends to focus more on psychological assessments, diagnoses, and potential treatment. So I decided to dedicate my time and career to just doing psychological evaluations.
That has really helped you too, Billy, in the school systems. The school systems have really used you a lot. I know that personally.
Yes.
When I used to be in the school system. So because you also were a special ed teacher, so that has helped with special needs and disabilities and testing there in those areas and them using you, having that dual relationship, so to speak, and them using you and you helping them with placements and stuff. That's invaluable.
Absolutely. And thank you for that. But yes, that's right. Also, I think it helps that I can understand what teachers are going through.
Mm-hmm.
And so I understand the time pressure that they have, the difficulties that they struggle with, because I've been there.
Mm-hmm.
And so I can relate to the teachers, and I feel as though they can relate to me as
Mm-hmm.
well, or at least I hope that they can.
Mm-hmm.
And whenever you have a relationship in which you can develop that type of rapport, then people are going to trust you more,
Mm-hmm.
and you're going to be able to work with them in a more collaborative manner,
Yes.
which is better for everyone.
Yes. And that testing situation, you need the trust. You need the alliance to be able to trust, because when you go in to fill out an assessment, when you're testing or whatever, it can be very scary.
Definitely.
Very scary, especially if somebody has some anxiety to begin with. We all have anxiety. Let me make this very clear.
Mhm.
Everybody has a bit of anxiety. It's just how much do we have? But it can be scary. So let me back up just a moment. When you were explaining psychiatry,
Mhm.
you said a psychiatrist is they're MD. They specialize in mental health, and they can prescribe meds and everything. What about, can they counsel? Do they choose to counsel? Or is it just that one intake? Some do, some don't.
I think that they can counsel to some extent. I don't think there's anything that prohibits them from counseling,
Mm-hmm.
but I'm not sure that they do.
Okay.
So if you think about family physicians or pediatricians who happen to be very knowledgeable with mental health,
Mm-hmm.
I think they could provide some guidance, and
Yes.
that's probably what a psychiatrist would do as well. But I don't think that they would actually go into counseling. I think they would leave that to the Susan Gosses of the world.
So it's more a time issue with them,
In
seeing
part,
so
yes.
many a time.
Well, and there's probably some training issues as well. You know, they have so much training from a medicine standpoint and a medical standpoint. I'm not sure that they've had the counseling coursework necessary for them to really be skilled or trained enough to do counseling as in-depth as LPCs do.
Okay. So we've got LPCs, we've got LMFTs, we've got social work.
Yes. Yes.
Licensed social workers, which we have here with us. They're excellent, and they're very, very well trained as counselors as well. That L in front is licensed social work and counseling. And so same counselors.
Yes.
Correct?
Yes.
And so you've explained very well the difference between psychology and
Psychiatry.
Psychiatry. See, I have to think about it to even say it for the listeners. But that's the big question I'm asked a lot. And you said you had somebody come in the other day that had it messed up.
They
was
did.
asking you for.
I did. I had someone come in and they were referred to me, and they pulled out probably 6 or 7 different medications. And they said, I was told that you could help me with my medication management. And I said, I don't know who told you that.
But I can't do that.
But this would not be me. No.
Yeah, but that's an easy mistake.
Oh, absolutely. And it's common.
I would say that was the next word going to come out of my mouth. It's also very, very common.
It definitely is.
So I hope this helps clarify that. And the reason we're saying this over and over again, it's Mental Health Awareness Month. I hope this makes it more aware of the difference between all of these titles, because it can get complicated very quickly.
Sure.
So we want to help clarify that. We did I don't know if you were there or not, I can't remember, Billy, but we did a CEU not too long ago here, that it was me and I brought Steve, and Steve brought some of his residents, about the difference between, we call it in therapy, we call it medical rule out.
Yes.
Where so many times we'll be in the office here in session, and we'll be sitting here, and we're going to talk about this at another episode. So you're going to hang around.
Okay.
Listeners, you're going to hear more of Billy. But you'll be sitting in a session and you'll be going along, and something will hit you that, hang on, there's something else in the room. And that's what we talked about in the medical rule out CEU. And it was fascinating.
Yes.
All the things that we miss, that we can miss, that are medical, that we confuse as mental. and vice versa that we look at as mental that are truly physical.
Absolutely. And one of the things that I have always said is, and I've yet to find an exception, Susan, and that is you always rule out medical issues first. Mm-hmm. And so then you move on to mental health second. And so there are times, just as you alluded to, there are times where I'm listening to something and I think, this doesn't sound like a true sort of mental health issue. There's something medically going on. Mm-hmm. And I remember one time I was referred to someone someone referred to me for ADHD. And it was an adult female, and everything looked really good except for part of their memory scores. And they were just really wacky. Mm-hmm. And I thought, none of this makes sense. And so for one of the only times in my career, I referred them to get an MRI, and I referred them back to their physician for an MRI, and they had a tumor.
Oh, my word.
Yes. And so they ended up having to have surgery. And so it just was.
Well, tell me it was a good outcome.
Yes, it was.
Oh, praise the Lord.
It was very good. But someone coming in for an ADHD referral, and then their memory scores are so wacky. And I thought, none of this adds up. This is not what I typically see.
Yes.
And so I referred back to the physician. And
praise
sure enough,
the Lord, they were referred to you.
Oh, well.
Seriously, because it mimicked that ADHD. Somebody was, let's say, smart enough to think they're so off. This is not normal behavior.
Yes.
And that's all they knew to do.
Well, and there's so many things that mimic other issues as well.
That's right.
And so there's so much overlap. And so being able to tease those out, tease medical issues apart from mental health issues is key to both what I do and what you do as well.
Oh, it is. And that CEU was fascinating. We were just doing one example after another of what we would see in our session. I had some fascinating examples in my own case studies of I knew something else was in this room besides mental. Then come to find out it was medical. Mm-hmm. It's so true. It's so true. So there's a lot more stories to come, listeners, so hang on. You don't want to miss these episodes with Dr. Billy Jones. It's hard for me to call you doctor.
Oh, you know what? I don't even ask people to do that. Okay. I prefer not.
Because,
I just rather be known
we're
as
such
Billy.
Good friends. It's got to be Billy. So you've got to come back. So join us again next podcast, and we'll see you. Love you. Bye-bye.
Thanks for listening to the Tangible Truth Podcast, part of the KLRC Podcast Network.